Do you have any close friends or even family that have passed away due to a heart attack? Hey, my name is Chris Neby, and today I'm going to talk about automated external defibrillators, or AEDs for short. Each year, over 500,000 people die from heart attacks alone, and some of these deaths can be prevented with rapid treatment with an AED. Today I would like to explain how an AED works, the steps of using an AED, and how education and location of AEDs are very important. An AED is a fairly simple portable machine that delivers an electric charge to a person's heart to hopefully get that heart to beat again. AEDs first analyze a person's heart rhythm to determine if it should shock or not. Then at this time, the AED will either advise or not advise the operator to shock. If shock is advised, the AED will send a shock through two pads that are placed on a patient's chest to hopefully get the heart to beat again. Using an AED is fairly simple. Most AEDs have walkthrough instructions that guide the user step by step. First and foremost, you always need to call 911 and make sure that emergency responders are en route to the location. Next, turn on the AED by pressing the power button and making sure it prompts you to make the next step. The next step will have you place the pads on the chest of the patient and let the AED analyze for a heart rhythm. If the AED advises a shock, you simply hit the button, making sure to keep yourself and others clear of the patient. After this, CPR will be continued on the patient. AEDs are extremely important, and anyone in the community can use them. The chances of survival go up significantly with the use of an AED, which makes implementing them in public places crucial. Good CPR plus the use of an AED is the only way to treat a person having a heart attack. Because an AED is the only way to restart the heart, it makes it a super valuable piece of equipment in public places. Time is also very important, as the chance of survival is minimal past around 20 minutes. The sooner you attach the AED to someone and provide shock, the more likely it is to be effective. Lastly, I would like to talk about location of AEDs and education. In most communities, fire departments head up educational programs to teach the public about AEDs. Here in Moscow, the Moscow Volunteer Fire Department has a program called Keep the Beat, where they offer to teach community members about and how to use AEDs. This program also fundraises to equip important locations around the Moscow community with AEDs, which they find is incredibly important because of the ease of use and importance of AEDs. I think they are a very important asset in the community. If you want to learn more or take a class about AEDs or how to use them, you can contact the Moscow Volunteer Fire Department. Thank you for listening and watching this slidecast.